Hello class, this week's lesson is about organizational assessment and a little bit about SWOT. So the objectives of this lesson are to explore elements of an organizational assessment, review the purpose of an OA, and examine models and frameworks when conducting an organizational assessment. And then distinguish alignment of an organizational assessment, quality improvement, evidence-based practice, and project management, and relate it to the graduate student role. And then we're going to, at the end, examine the SWOT analysis. So what does an OA have to do with quality improvement? First of all, it provides context. It's the circumstances that form the setting for an event, statement, or idea, and in terms of which it can be fully understood and assessed. An OA and evidence guide quality improvement projects. Let me say that again. Together, an organizational assessment and evidence from the literature guides a quality improvement project. So OA is objective, systematic, and data-driven. It provides clarity in what the problem or focus may be based on and characteristics of the organization. It looks at change, leadership, and management, and it's the foundation for understanding, planning, and implementing QI. You'll see several tools for conducting organizational assessments in Blackboard. So think about this. What would you do for a patient without conducting a physical assessment and reviewing their history? So on an individual single patient basis, you first do a physical assessment and review their history prior to providing care. The same is true for quality improvement in healthcare. The first thing you do is conduct an organizational assessment and SWOT, and then look at what's happening with current practice. So when you're conducting a physical assessment for an individual or examining an organizational assessment and SWOT, it's the same thing. It's either at the patient level or at the system level. And when you review a patient's history, it's the same thing as reviewing current practice in an organization or system. So it's very similar to a process you already understand with individual patient assessment. It's just done on a broader scale at the organization level. So with individual patient care, you conduct a physical assessment, you review the history, design a plan of care, implement the plan of care, and then you evaluate and measure the effectiveness of the plan of care. And if needed, you modify it, redesign it, or continue what's already in the plan of care. All along the way, you're evaluating and measuring the effectiveness of the plan of care. And you report the results, usually in an electronic health record. And often you finalize care. But as with all patient care, there's usually 5 to 8 repeat cycles of 1 through 8 over and over again before they improve, or with hospice care before they're passing away. You know all of this. You've done individual patient care now. You understand it. But quality improvement in a healthcare system may be new to you. But it's the same process as individual patient care, just on a broader scale. The first thing you do is conduct the organizational assessment, and you review what's happening with current practice. Then you design your QI plan and implement the plan. And then what you do is evaluate and measure the effectiveness of the QI plan, and if needed, you modify, redesign, or continue the QI plan. All along the way, you're evaluating and measuring the effectiveness of the QI plan, and in the end, you report results. It's the same as individualized patient care. You often have to do 5 to 8 repeat cycles to actually experience improvement in care. So as you can see, these two are very, very similar. This one is at the individual patient care level, and this one is at the healthcare system level. So a lot of this you already know. You just need to apply it in a broader scale. There's so many similarities between individual patient care and quality improvement. Number one, you conduct the physical assessment or you conduct an organizational assessment. Number two, you look at the individual's history or you review current practice in the organization. Number three, you design an individual plan of care or you design a QI plan for the organization. Number four, you implement the individual plan of care or you implement the QI plan for the organization. Number five, evaluate and measure the effectiveness of the individual plan of care or the QI plan. It's exactly the same, just on a broader scale. And number six is the same too. You modify, redesign, or continue the individual plan of care or the QI plan. It's exactly the same, just on a broader scale. Number seven is the same too. Evaluate and measure the effectiveness of the individual plan or the QI plan for the system. Number eight is identical. You report the results. And number nine is identical. Either you finalize it or you often have to repeat it 5 to 8 times to either experience improvement in the individual's health, or if they're terminal, they pass away. Or number 9, you seek and find improvement in the healthcare system. So a lot of this you already know. You're just doing it at a broader scale, and some of the terms that we use are a little bit different for QI. So why is an organizational assessment necessary? Well, as most of you know, an organization is a very complex entity. It's a social unit comprised of people with specific roles and responsibilities that must align themselves in pursuit of a collective goal. Knowledge of relationships of the various contributing factors of an organization, as well as an understanding of the common purpose, is vital to the success of organizational change. In other words, QI, quality improvement. Prior to implementation of a QI project within an organization, an assessment must be performed so that you know what's happening in the organization. So organizational assessment is a comprehensive analysis of the current state of an organization and or a practice. An organizational assessment is used to identify an area in need of improvement and to determine the importance and value an organization will place on the proposed change. It's essential for a graduate student to conduct an assessment to develop a clinical question that aligns with the needs of the organization. As most of you already know, change is hard. Most of the time, there's problem solving, but no structured approach to an organizational assessment. To have baseline data to compare after quality improvement, you must know if there was an actual improvement. So to leverage the strengths and bring awareness to potential barriers and or facilitators, you do an assessment to identify gaps that need improvement and to inform a quality improvement project. It's one of the initial steps of doing QI. So the characteristics of an assessment of an organization includes looking at the abilities, credibility, and capacity, and the context within how things are done and why they're done. Basically, you're gathering information and data about performance to identify possible areas for improvement or an intervention. It may include internal and external influences, aspirations like the mission, vision, or values, alignment to strategic plans or goals, and it also should look at leadership and how decisions are made, who the important stakeholders are, and the culture of the organization. Systemness linkages to partners, subsidiaries, and organizational resources are also important with an assessment. So is capacity, the human resources, the technology infrastructure, fiscal resources, process and program management, their QI philosophy and framework, and if they have incentives and rewards. And finally, it may also include organizational performance effectiveness, efficiency, relevance, and financial performance. So as you can see, an organizational assessment has a lot of depth. There are several models or frameworks that you can use to conduct an organizational assessment. It just depends on what type of project you're doing. There's the 6-box, the 7S, the STAR, the congruence, and the Burke-Litwin. And within Blackboard, there's folders about each of these models or frameworks. So the 6-box organizational model has a key focus on 6 variables: purpose, structure, rewards, helpful mechanisms, relationships, and leaderships. This model is useful to maintain awareness of all areas for consideration, even though one variable may be identified as the main area for attention. The 7S framework focuses on 7 key components that affect organizational effectiveness: structure, system, style, staff, skills, strategy, and superordinate goals. The interconnectedness of these variables is vital to the success of change. And then there's the congruence model. The organization is broken down into 4 components: task, individuals, formal organizational arrangements, and informal organization. This is influenced by the context where the strategy is formulated, and the output is then the performance of the organization. And then there's the Burke-Litwin model. This model identifies the transformational, external, environmental, mission, strategy, leadership, and organizational culture, and also the transactional sources of change. To date, about 80% of the KCON DNP students use this model to do their organizational assessment for their DNP project for graduation. There's some articles in Blackboard about this model. So how do you do an organizational assessment? Follow these steps to conduct an OA. Select a model or framework that fits the organization and the context. Examine the model or framework to inform collection of assessment data. Identify what data is already available, both quantitative and qualitative, and then determine what data needs to be collected and how to collect it. Obtain and/or collect data and analyze it, usually in tables and graphs like the IHI training you had earlier in the semester, and use the OA to inform the SWOT. And then you use the OA and the SWOT to formulate the clinical question and the QI plan. And usually you prepare a written summary of the OA. So one of the important things in all assessment is key stakeholders. They're critical to the success of any change project. So you need to identify who the stakeholders are, who has power, who will resist the most, how can support be gathered, and how can resistance be reduced. This is very important to any QI project. So the Burke and Litwin model can be used to define and identify organizational dimensions which are linked causally in order to promote and achieve change. It hypothesizes that there are 2 distinct sets of dynamics within an organization: climate and culture. Climate refers to the conscious perceptions employees have about how the local work environment is managed and how well day-to-day colleagues collaborate. Whereas culture is the underlying set of values and norms in the organization, a collection of overt and covert rules that guide organizational behavior and is more background than climate. The variables that define organizational climate are transactional factors, and those that define culture are transformational factors. Although ultimately transformational shifts are necessary for successful change, knowledge of both the transactional and transformational factors are necessary as they may directly and indirectly influence each other. Transformational factors are the most influential forces of change for an organization. They include the external environment, mission and strategy, leadership, organizational culture, and individual and organizational performance. The external environment is the most persuasive transformational factor to drive change within an organization. These factors require an analysis of an organization's macro level for proper evaluation. It's important to analyze the transformational factors in the organization to discover which organizational dimensions need to be addressed during the practice change phase of the project. Whereas transactional factors are the structural components of a work environment's climate. They consist of everyday exchanges between members of the organization. It explains the reciprocity of human behavior. In other words, you do this for me and I'll do that for you. It includes structure, management practices, systems, work unit climate, task and individual skills, motivation, individual needs and values, and individual and organizational performance. These factors directly and indirectly affect and are affected by transformational factors. Manipulation of these factors can produce short-term gain, but rarely a sustained change if done in isolation of transformational factor manipulation. So in essence, you need both. Macro level assessment using the transformational factors includes the external environment, any outside condition that influences how an organization functions. Outside conditions can include government policies and political circumstances. Healthcare delivery has become a key political issue over the past decade. IHI challenged healthcare deliverers to improve healthcare delivery by using approaches to meet the components of the Triple Aim. Improve the patient experience, improve population health, and reduce per capita cost. Whereas macro level assessment using the transformational factors looks at the mission and strategy. An organization's mission and strategy are declarative statements that identify their purpose and intention. The mission is the goal of the organization, and the strategy is how the organization intends to obtain its goal. And leadership are the executives that provide overall organizational direction and serve as behavioral role models for the employees. And culture has the enduring values and principles of an organization that guides its behaviors. Also, there's structure, the arrangement of functions and the division of people into specific areas of responsibility in order to assure effective execution of an organization's mission and strategy. There's also management practices. These are what the leaders do to inspire employees to carry out an organization's strategy. And then there's systems. Sometimes there's standardized policies, procedures, or workflows and staffing that facilitates work that are oriented to the organization's mission. There's also work climate, feelings members of the organization have towards their local work setting, which can affect relationships among co-workers. And then there's task requirements and individual abilities, which are the skills and knowledge required of the employees to accomplish the tasks each one is responsible for. And then there's individual needs and values, which are the psychological factors people possess that enrich their job and life experiences. And then there's motivation, the tendency to move towards a goal and to persist until the mission's achieved. And also individual and organizational performance, which is learned by the measurement of outcomes, which is what you'll be doing as a DMP student. And finally, what is a SWOT analysis? It examines and guides you to look at 4 different elements Inside the organization, you look at the internal environment and their strengths, which are their positives, and their weaknesses, which are negatives. Outside the organization, you look at the external environment, opportunities, and threats. A SWOT analysis helps you develop an awareness of an organization to help with planning and decision making. It's a key element of any D&P work and a big part of quality improvement. So when do you use a SWOT? You can use it during and after the organizational assessment to explore possibilities to problems, make decisions for the QI initiative, determine where change is possible within the organization, to refine plans before starting, and to adjust plans mid-course. The key stakeholders mentioned earlier are very helpful with developing and designing a SWOT analysis because they have a lot of experience working within the organization. So basically, you ask stakeholders to answer questions. What are the strengths and weaknesses of the setting? And what are the opportunities and threats facing it? You brainstorm the positive and negatives with your key stakeholders, but continue to think broadly about the organization and its external environment. And you always need to confirm your identified SWOT elements with one or more experts within the organization, because they're there every day and they know best. This is what a box SWOT design looks like. It has 4 elements: strengths, weaknesses, opportunities, and threats. So when you're listing the internal factors, the strengths and weaknesses, areas to consider include human resources, staff, volunteers, board members, target population, and also physical resources, your location, building, and equipment, and financial resources, grants, funding agencies, and other sources of income, as well as activities and processes, programs and systems, and also very helpful when doing the strengths and weaknesses are past experiences, because they're building blocks for learning and success and building someone's or organization's reputation in the community. When you're thinking and listing opportunities and threats, forces and facts that the organization does not control, think about future trends in the field or the culture, the economy, local, national, or international, funding sources like foundations, donors, and legislatures, and then the demographics, changes in the age, race, gender, or culture that's served, the physical environment, legislation, and local, national, or internal events. So how do you do a SWOT analysis? Follow these steps. Designate a leader or group facilitator. In essence, it's you as a DMP student. And then you think about having someone as a recorder to include all the information in the boxes. Introduce the SWOT method. Let all the participants introduce themselves and have each group member someone designated as a recorder, and allow the group to provide input and share results and discuss and record the results. And usually you prepare a written summary of a SWOT analysis. And we always include a written SWOT whenever we're doing quality improvement, and in particular with a DMP project. So how do you use an organizational assessment and a SWOT? So basically you use the assessment to inform the SWOT, and you use the assessment and the SWOT to confirm your findings with the organizational leaders. And again, you use them to inform and formulate a clinical question and a quality improvement plan. You would never do patient care without first assessing the patient. So you never do quality improvement without first assessing the organization and doing a SWOT analysis. So think about the assignment for this week is to complete your worksheet by doing your assessment. But remember, QI is an iterative process, and the worksheet may change as you learn new or additional information or find new evidence. To prepare for your practice change, you think about doing your assessment and what your organization looks like, and what you would need to do the quality improvement, and then how you would sustain it over time. So in essence, for this week, what you're doing is an organizational assessment and SWOT and completing the mini paper that you will be submitting in Blackboard. Thank you for listening to this lesson, and if you have any questions, please let me know.